Innovation event. We're pleased to welcome now Nick Webb, world-renowned strategist, best-selling author, and futurist. Nick, thanks for coming on.
Yeah,
man.
you
appreciate it.
Glad to be here. Appreciate it.
So what do you think about events like this? I think we're going to see more and more of these sorts of gatherings across our country as we sort of plot our digital future.
Yeah, I think that businesses, government, universities, they're trying to get some curation, right?
Yeah.
They're trying to get experts to come in and help them curate the rapid change.
Yeah, that's a great way to put it. And certainly you being here, we're certainly pleased to have you in the great state of Mississippi here in the northeastern part of our state. Some of us kind of refer to it as just the border of Appalachia part of it,
yeah.
right? We got to go a little further northeast, you start running to the foothills. But this is a vibrant, thriving area, as I'm sure you have seen. And, of course, in many of our states, as you well know, like Mississippi, they're rural, and we're trying to get high-speed internet. I mean, we got to have the information superhighway connectivity in order to take advantage of this explosion of technology. And so a lot of the folks here today, as you know, that's what they're busy doing, is installing fiber across our landscape. And that's happening across the country, is it not?
It is. I had the great honor of being the keynote speaker a few years back for the American Broadband Association, I think it is.
Yeah.
And so we did some research at that time. We have a thing we call Trend GPS, where we take a look at, a variety of different data signals. And look, I mean, we went from, by necessity in the Industrial Revolution, of creating central hubs. And those central hubs of manufacturing resulted in central hubs of healthcare.
Yeah.
And then, and everything else. I think what we're seeing in the great opportunity for northern Mississippi and other rural communities is it's kind of the great equalizer, right? Our ability to, and when you take a look at what's happening to the decentralization of patient care, a lot of people don't realize how fast that's coming along. We're at a point now where, we want people to age in place. We want people to have care in place. Yeah. So they're going to be, and we're seeing a lot of experiments with this right now, but it's rapidly scaling to where when you get your medical insurance, you get a kit, and the kit has an otoscope, an ophthalmoscope. It has point of care blood testing, and so it's not like it used to be where it was just the signal of them talking. The cool thing about it is we're even using facial AI. We're using voice AI to be able to understand emotional states during telemedicine visits. So again, there's a great deal of layered technology and richness to remote care, which is going to provide a lot of high quality care while improving the access in rural areas.
And that solves a huge problem. We have that problem here in the state of Mississippi, where we have a lot of citizens that live in rural areas, and the healthcare providers are just not within any short distance.
Right.
This is a way to get the provider services to them electronically, essentially.
Right, and the other thing is they can talk to, subspecialists. There's so many subspecialties of subspecialties. Yeah. So they can gain real access to real providers real fast. And we're also, there's a thing called talk telemedicine where, some people want it to be just talk. But we're also leveraging the camera to take a look at ethnographic data. So we can actually, while the doctor's talking to the patient, it may be looking to see what kind of environment they live in. And it's also picking up signal for facial AI, and then it's picking up emotional data on voice AI. And then you combine that with the data, these simple data solutions. For about $6, we can provide kits to patients that give them advanced care. So it's really, really exciting.
Don't you see this getting to the point where you literally sit in your living room and through your television, used as a communications device, as a monitor, you'll interact with these physicians and receive a lot of your care through that, and then have all the other devices, as you said, that can handle some of the other testing and diagnostics?
Right. They're saying that only 10 to 20% of a provider visit is ever, a physical visit is ever really required.
Yeah.
Right. Because with the blood pressure cuff and a few little simple instruments, they can get the same amount of data they'd get. But think about the friction and the staffing and all the problems. We can increase access, improve the personalization. The other thing it does is it kind of creates this sort of tunnel, right? It's you and the doctor. It feels different than the doctor having the traffic signals in his thing, letting him know when his next patient is, the nurse coming in and out. It creates, I think, and it turns out, 80% of patients prefer telemedicine. Some data says it's as high as 90%.
Yeah, and you got to believe the adoption will increase as our population sort of ages, and the younger generation who's accustomed to this mode of communication becomes the next generation patient, so to speak.
Right.
So
Another big area is what's called asynchronous telemedicine, where, you're a 23-year-old woman, you've had reoccurring bladder infections or UTIs. You can text your provider, and your provider can wait at the end of the day and batch that. And because batching creates efficiencies, they'll look at it, take a look at the history of the patient, send them a text back with a note that they've already sent in the prescription.
That's pretty cool. So as a futurist, what trends are you tracking? I mean, we've had a great discussion about healthcare here, but what else are you tracking you think is significant?
I think that really when you take a look at the layerization of technology on all things, right? How do we add data layers into manufacturing? How do we add data layers into, I mentioned in my keynote, in video signals? How do we add layers to telecommunications? So I think the biggest exciting opportunity is really twofold. One is the way in which we improve cooperation between the thinking, learning box and all emerging technology. But also I think the big advantage is looking at the layerization of value. So we can improve and the beauty is, and you mentioned it in your great keynote this morning, is that the beauty is the balance between technology and the human. And if we do that right, our ability to have a more humane and more happy and more functional culture, despite the fact that many things are done through robotics and AI, is there. But it seems oxymoronic, right?
I agree.
Yeah.
And a healthier, more prosperous culture as well. And we're creating all sorts of opportunities. I know one of the things that I recall from a keynote at a Cisco Systems Partner Conference by his name escapes me, the longtime CEO, John. Name escapes me right now. But nonetheless, he was giving a keynote, and he was talking about children born today will work a job that hasn't even been invented yet.
Right, yeah. Yeah, as I mentioned, by something like 87% of the jobs will be in, haven't been in, that will be in 2030 have not yet been invented. That's crazy.
Incredible.
Yeah.
John Chambers, it just hit me, so I can't believe. But he also said that we're all subject to being disrupted. That stuck with me. And this was 8-10 years ago. He actually said we're all subject to being Amazoned or Ubered, is the way he described it.
Right.
He said that in their view, perhaps a third of the businesses in operation today would be replaced within 10 years.
And much of that has to do with experiential value, right? Because if you can buy the same stuff on Amazon as a Shopify account or whatever, you probably buy it on Amazon because you're a Prime member and you get it shipped for free or it's convenient, whatever.
Yeah.
Where the competition for customers, for students, for constituents, for you, whoever your customer is about who delivers the best experience.
No doubt about it.
Yeah.
And that is something that Amazon is mastered.
Yeah.
And if you go back and listen to Jeff Bezos and his vision for that, that's exactly what he says. We wanted to make it the absolute best experience. Now, in doing so, I think it's addicted a lot of people.
Yeah,
Perhaps
right.
it's just 2 buttons and, stuff's at your house that afternoon.
Right. Well, they even realized back in the old tyranny of the early days of Amazon, you'd have to take your index finger and you would find something and then you'd have to put it in the cart.
That's right.
And that was like tyranny, right? So he said, well, wait a minute, why don't we just swipe, a buy with one click and then swipe.
Made perfect sense.
It actually started buy with one click, and then people were buying stuff before they really wanted to, right? So, 2 simple moves, and it's yours.
Well, people buy experience, do they not? They buy value, they buy experience.
Right, and the same with employees, though. That's why we have this new body of science we call HXI, Human Experience Innovation. If you have a really bad culture, your employees aren't happy. And if they're not happy, they're not delivering value to the customers.
Oh, there's no doubt about it. So we've sort of evolved, have we not, from the CXI. We still have that, customer experience.
Yeah.
Now it's human experience.
Right, because you have to look at it holistically, right? You can't, the best experiences, and I wrote What Customers Crave and What Customers Hate. And what I found when I researched those 2 best-selling books is that you can't have happy customers unless you have happy employees.
Oh, there's no doubt about it.
And you have to connect the experiential value of the employee to the experiential value of the customer. When we were trying to do just customer experience design, it failed always, right? Not only that, we got bad data. We used VOC data, and we used, net promoter data, which is good, but it's not complete. And it's oftentimes, there's much better ways to do that.
Yeah.
And so,
And companies are hyper-focused on this because they understand that translates to success.
It's sales.
Translates to
revenue.
bottom line. That's the whole idea.
The key is you got to get new customers, you got to keep customers, and you got to get those customers promoting you to other customers.
Wow.
All of that is experiential innovation. And the same thing you could say is true with employees. You got to get great employees, you got to keep them,
right.
and you got to get them to help you find more great employees.
But the good news is, Nick, we've got all these fabulous tools.
Yeah.
Right, to enable us to achieve those goals that we just didn't have. And additionally, these tools are available to all levels of businesses.
Yeah.
It used to be kind of reserved for the largest businesses with the biggest bank account. That's not the case anymore.
No, it isn't. No, that's the need. It democratizes it because it's affordable and accessible. Just like I said, the biggest challenge and the biggest resistance is you got to lean into the blur of change.
Got it. You're going to hang around with us for another segment?
I've got a car sitting out there waiting for me. Yeah.
All right. Well, we appreciate you coming on. Nick Webb, stay with us, folks. We're coming.